Hi everyone, it's Dr. Dave, and I am coming back to you with a very popular topic and one I've spoken about many times on this channel, fish oil. So fish oil, omega-3 fatty acids, are a $4.1 billion industry in 2019, and that is expected to double in 2025. So people love fish oil. They like the idea of fish oil. It's going to make them healthier, live longer, etc. And as you know, I've spoken about fish oil. And in the right patient, fish oil can be beneficial. And when we say right patient, we're talking about patients who typically have vascular disease. What do we mean by that? Vascular disease, blockages in the carotid arteries, blockages in the coronary arteries of the heart, blockages in the legs. Basically, any artery that has a lot of cholesterol buildup or moderate cholesterol buildup will probably have some benefit with fish oil. Why? Fish oil does lots of things. It's an anti-inflammatory. It's a mild blood thinner. It will lower your triglycerides, the fat in your blood. It has been shown to decrease the amount of plaque in some arteries. So if you have cholesterol building up, fish oil may be an important weapon in the armamentarium of fighting heart disease and strokes. But here's where it gets really interesting. Recently, there have been about 4 major studies looking at fish oil, predominantly for its benefits on cholesterol buildup and atherosclerosis. But what was very interesting in these trials, almost all of them, when fish oil dosage is 4 grams, typically 4 pills, typical fish oil pills are 1,000 milligrams or 1 gram. So when somebody is taking 4 grams or 4 fish oil pills, they are at increased risk of developing an arrhythmia called atrial fibrillation. So although they may be having the benefit of fish oil on cholesterol buildup, they may also be at risk for developing an arrhythmia. So like they say, there's no free lunch. And what makes me very nervous is, people on the internet Google what's good for the heart and they come across fish oil and it seems like a no-brainer, right? It seems innocent enough. Take fish oil and you should have some benefits when it comes to heart disease. But we have to be really careful with therapies, even over-the-counter therapies, because in excess, these can be dangerous. So what I tell my patients is speak with your doctor, your healthcare provider, about fish oil or any over-the-counter medications. They should be knowledgeable. I'm a practicing cardiologist, traditionally trained in Western medicine, but I'm open-minded and I'm always trying to learn about more alternative approaches to fighting heart disease. So although fish oil definitely has a role in certain patients, it can be beneficial, we need to temper that excitement and enthusiasm with the understanding that at higher dosages, 4 grams, you may be doubling your risk of developing an arrhythmia called atrial fibrillation. Now, these studies have shown that at lower dosages, 1.8 grams borderline risk, 840 milligrams, I guess about 1 pill, no risk. So it's not just the fish oil, it's the amount of fish oil. And we have to be careful. Maybe it's prescription fish oil versus over-the-counter fish oil. We don't know. But the message today is, yes, fish oil may be beneficial, but it may also be risky. Okay, until next time, this is Dr. Dave.